Let's talk about segmental anatomy of liver. Two important blood vessels that are hepatic vein and portal vein divides liver into 8 different segments. Look at this diagram. This blood vessel here, this represents portal vein. Portal vein is formed by joining superior mesenteric vein and splenic vein at the level of neck of pancreas. After forming portal vein, it ascends towards liver and it divides into left portal vein and right portal vein. Similarly, this posterior structure here, this is inferior vena cava. Inferior vena cava has 3 different tributaries from liver. They are left hepatic vein, middle hepatic vein, and right hepatic vein. The part of the liver that lies lateral to this left hepatic vein are segment 2 and segment 3. Similarly, the liver segments between left hepatic vein and middle hepatic vein is segment 4. Between middle hepatic vein and the right hepatic vein are segment 8 and segment 5. And lateral to this right hepatic vein, the segments are segment 7 and segment 6. Segment 2, segment 4A, and segment 8 and segment 7, these are above this portal vein. So this portal vein and its branches actually divides the liver into superior segments and inferior segments. Segment 2, segment 4A, segment 8 and segment 7 are superior segments, while segment 3, segment 4B, segment 5 and segment 6 are inferior segments. Segment 1 is located posteriorly near the inferior vena cava. Here you can see this is segment 1st. Segment 2, 3 and 4 are commonly represented as left liver lobe. Similarly, on right side we have 4 different liver segments going from 5, 6, 7, 8 clockwise. If it is above the portal vein, then these segments are segment 7 and segment 8. Below the portal vein are segment 5 and segment 6. So this is the diagram showing 3 hepatic veins. Hepatic veins join into inferior vena cava. We have 3 different hepatic veins: left hepatic vein, middle hepatic vein, and right hepatic vein. This is the ultrasonographic image of the liver showing 3 different hepatic veins. This entire homogeneous structure is liver. This structure here is inferior vena cava. It has 3 tributaries from liver. This is the left hepatic vein, this is middle hepatic vein, and this is right hepatic vein. The part of the liver lobe that lie lateral to this left hepatic vein are segment 2 and segment 3. Between this left and middle hepatic vein is segment 4A and segment 4B. Here this is segment 8 and segment 5. This is segment 6 and segment 7. Now let's talk about portal venous anatomy in ultrasound. Portal vein is formed by superior mesenteric vein and the splenic vein. They form the portal vein at portal confluence. This portal confluence is located just posterior to the neck of the pancreas. After forming the portal vein, it ascends towards the liver. It enters the hepatic hilum and divides into left portal vein and right portal vein. Right portal vein again divides into right anterior and right posterior segment. So here in this diagram, this most posterior structure is the inferior vena cava here, and the portal vein has already formed in this diagram. So portal confluence should lie here. So after forming the portal vein, it divides into left branch and the right branch. Left branch has medial and the lateral branches. Right portal vein has anterior and the posterior branches. Portal vein can be differentiated from hepatic vein as the portal vein is surrounded by echogenic rim. Here in this diagram, you can see this is the basal lumen. On the peripheral part of the basal lumen, you can see this echogenic rim. If you see this echogenic rim around this blood vessel, then this is portal vein. Whereas in hepatic vein, you cannot see that kind of echogenic rim. So this is hepatic vein. You can easily identify hepatic vein from portal vein by absence of echogenic rim around the blood vessel. Another important thing that you have to remember is inferior vena cava is most posterior structure. Here in this diagram, you can see this is IVC or inferior vena cava, and this is portal vein. Portal vein is located anterior to the inferior vena cava. So in ultrasound, anything that lie in the superior aspect of the screen, this is anterior and this is posterior. So as IVC is located most posteriorly here in this diagram, so this must be inferior vena cava, where this is portal vein. This homogeneous isoechoic structure is liver, and this hyperechoic rim on the right lateral aspect, this entire structure is diaphragm, and these are the hepatic veins. Liver has right liver lobe, left liver lobe, caudate lobe, and quadrate lobe. Identification of caudate lobe is important because we can make a diagnosis of chronic liver disease based on the size of the caudate lobe. So, caudate lobe is located posteriorly near the inferior vena cava. First, you have to identify inferior vena cava. This structure here is inferior vena cava. This is located posteriorly, or it is located in the inferior aspect of the screen. So this segment here, this represents the caudate lobe, and this entire large liver lobe is right liver lobe. This hyperechoic line here, this represents diaphragm. This is the longitudinal view of the liver. This blood vessel here, this is inferior vena cava. The liver lobe that lies just anterior to the inferior vena cava, this is the caudate lobe. And this is the hepatic vein. Hepatic vein drains into inferior vena cava. Again, in this diagram, this structure, entire structure is liver. So this small fluid-filled structure here is the gallbladder. This is the fundus of the gallbladder, and neck and body should lie here, which is not visible in this diagram. This vessel with peripheral echogenic rim, this is portal vein, and similar blood vessel without peripheral echogenic rim, this is hepatic vein.